Morning again. My name is Jason Willis. I am a public policy professor at McGeorge School of Law at University of the Pacific. And I have the distinguished pleasure to help steer the boat, if you will, on the policy panel that we have here today with some three, in my humble opinion, amazing, insightful, and thoughtful panelists. And we're going to get to that shortly. In order to set that up, for any of those of you that were here last year, we did another policy panel that basically kicked off a body of research that Breaking Barriers and many of its partners have been doing, looking at California's policy process, specifically how we construct bills, how we assign funding to different agencies and organizations. And so part of today has a couple of aims. The first is to really share some of the early findings from that research, which I will emphasize the point of early, but are truly insightful. I was saying to my youngest son the other day as I was sketching literally on the back of a napkin that this was kind of early going. And he's like, "Papa, why didn't you put that in a PowerPoint slide?" And I said, "I'm not ready to put it into a PowerPoint slide because I'm not sure yet what the data is saying." So we'll talk a little bit about some of that early finding today. The second is the panel that I mentioned, and the panel that we have today is here to, in part, respond to what some of these early findings are. They come from a variety of different levels of California's government agencies. They've worn many different hats, so very excited for them to respond. And in some cases, some of the things that I'm sharing with you this morning, they have not even seen, which I did give them a little bit of a heads up about. So we'll get a chance to kind of hear some of their kind of raw reactions today from some of the things that I'm sharing. So let's get started. In the research that we did last year, one of the things that we caught on to, one of the reasons we wanted to investigate this set of questions, it came from a comment that came up in the ecosystem paper when we were interviewing. And I love this quote. In some ways, I think it really foreshadows some of the things that we're starting to find. "We tie the hands of those we are asking to implement policy as a result of the conflict in our own policies and lack of any thoughtful and comprehensive implementation design." Keep that in mind. So let's start with some early findings on the existing process. First and foremost, kind of a double-edged sword to constitutional democracy. It's the thing that basically is the foundation of how we create policy, how we fund government in the state of California and states across the country, including our federal government. And what we found is that while there was a lot of access to the policy process, right, there was a lot of opportunity to weigh in, to offer bills, it also created a lot of, we'll say it, chaos, right? A lot of folks getting engaged in the process is really good for democracy, but at the same time, when you have a limited amount of time, which leads to the second initial finding, is that there was a very high proportion of bill volume over limited staff, right? So the basic equation is if you have something on the magnitude of 5,800 bills that go through a legislative session, that is an approximate number of the number of bills that went through the Assembly and Senate last year. Just let that sink in for a second. 5,800 proposed bills divided by a limited amount of staff time, right, the staff that work for elected leaders, committees, et cetera, you really are getting at the bare minimum of looking at how policy can effectively support the work that all of you are doing in counties and in local communities in California. Also, what we found, we asked this question around incentives. And one of the things we wanted to understand is for individuals that are in the policymaking process, how are they incentivized to integrate policy across sectors? And what we heard is that there was little to no incentive. In fact, in some cases, they were actually confused about the question. They would say things like, well, why would I want to be incentivized to integrate policy? So, and I think it's an important moment here to pause, because it may seem like that statement is really attributing it to the person. And I think it's important for everyone in this room to remember that that attribution is not to the person, it is to the system. And when individuals, people, are in systems for that long, they become attributed. They become conditioned. to think in the way that the system has taught them. And so our system is telling us that right now there is no reason why we should be integrating policy. The last thing that I think is important to remind myself and that is coming up in these early findings is kind of this out of sight, out of mind. Once the policy process has happened in Sacramento, there isn't a lot of circling back, right? There isn't a lot of, is there an opportunity for us to understand what actually happened as a result of the policy? Now, this does happen to the credit of the Assembly and the Senate. They will hold hearings in years after policy has been passed. They will gather experts that have been looking at data and research and evidence. But I would suggest this is a pebble in a very large pond in terms of the effect that that has on future policymaking in the state of California right now. So I'm going to go into my on the back of the napkin description. This is the basic policy process that we've been sharing with the interviewees. We use it as a standard part of asking a lot of questions about their involvement and what their experience of the system has been. And what you're looking at on the screen is really the kind of closed circuit response, right? So this is the governor and the legislature, the kind of formal steps that the state takes to first propose a bill, move it through a process before it goes to the governor for signature. Now, one of the other things that we've been able to map is that there are different types of other organizations, we'll call them organizational types, that surround that process. So for example, we have advocates, and one of the members of our panel sits in that group of organizations. They're advocates. They are advocating for certain policies to change as they're hearing work that's needing to be done on the ground level, in this case with children and youth. There's other groups like member associations. In the education community, for those that are familiar, we have the Education Coalition, for example. There's also other groups, research, nonprofits, higher ed institutions. I am a member of that group of organizational types. And still more, businesses, right? In health, we have insurance companies, healthcare plans, all kinds of things. You get the point, right? Okay, so when we think about these organizational types and then we start to map, well, do they look or exist in different spaces? What we can start to say is that for each one of those organizational types, you now have a sector that is assigned to that organizational type. Education, health, and I can continue, right? I just didn't have any space on the PowerPoint slide, right? You're gonna get this point in a second. So I kept going with this, and I was asking my youngest son, and he looked down and he said, "Papa, what's on the page?" And I was like, "I'm not really sure, but I'm gonna share it with a bunch of other really, really smart adults, and then they're gonna tell me what's going on." This is what I drew. Right? We giggle, we laugh at this, but this is it. And there's a couple interesting things that are coming out of this. And again, very early findings, we're continuing to kind of think through how to map this, but look at the loops. And the loops are connected to steps that each of these organizational types and within sector usually go through as a way to influence, inform, and guide the policymaking process. But the loops don't overlap. They rarely overlap. And it's not to say that those conversations don't happen, right? Like I am traditionally from the public education world, and the Education Coalition will talk to groups in the advocacy space that work on educational equity issues. That happens all the time, right? But the loops themselves are so powerful that they stay and reinforce one another over and over and over again. So what we've created, at least in part from initial mapping from our research, is exactly what all of you are experiencing on the ground, right? This siloization of both organizational type and the sectors in which you're working. So I want to take a couple of minutes to move into improvements, right? Like what did we hear about improvements so far? I want to share one last piece of data, and then I'm going to invite our distinguished panelists up to get started on the panel. So first, that 80% of the interviewees so far have said better policy integration equals better integrated service delivery. Right? So if we get better, at the state level in Sacramento of thinking about how policy, either what I would say on a horizontal level, how, for example, health is integrated with education, is integrated with child welfare, or on a vertical integration level, that is how the state is articulating something at the policy level and how that is then translated in its intent to the county or regional and to the local level. If we get better at that, 8 out of 10 people said they think that leads us to better integrated service delivery. Now you may ask the question, is that actually gonna happen, Jason? I don't know. But that's what the interviews are saying to us. And these are the people that are in the process working on the policy. The other thing that we find is that the policy mechanisms currently really tinker. They don't incentivize. What I mean to say by that is there are existing mechanisms like the dual referral process. If anybody's familiar with this, this is a process inside of the Assembly and Senate in which a committee can basically refer a bill to another committee and say, there's something in this legislation that you need to pay attention to because it affects the issue that you are reporting on. But what we came to find is that the dual referral process is actually rarely used, and when it is used, people tend to strip things out so that they don't have to do the dual referral process. Now you might say, why would somebody do that? Because we want policy that's better reflective of supporting children and youth. And I submit to you that I go back to one of my early findings. It is about time. There are pressures that sit on elected leaders and staff that are working on policy in California that is, I don't want to say identical or near same, but very similar to the pressures that all of you feel in your work on a daily basis, right? And that pressure is driving a set of behaviors that are pushing and not getting us to a place that we're saying may get to better children and youth outcomes. Now, all this to say, like dark and stormy clouds on a Tuesday morning with coffee, that's not my intention. And there have actually been some glimmers of progress here. And I think one of the biggest ones were citations around, for example, the cradle-to-career data system. It's one of the biggest efforts that this state has had to integrate data across systems. And the great news is that it echoes many of the best practices that we've seen in states across the country as well. The other items that were kind of mentioned as hopeful were things like CYBHI and community schools, right? Many saying, like, we wrote this, there was an intention that these bills would help to bring people together across sectors, across organizations in a way that can help children and youth. And I will stand right next to you, shoulder to shoulder, to tell you there are a lot of challenges in both of those bills, in both of those policies. But you gotta remember the intention, right? So if the policymaker's intention is that they want to get there, they probably need to hear sooner rather than later what needs to be fixed. And that is one thing that we've been finding in the interviews, that there is a lot of intention of wanting to listen and wanting to hear what is happening. So finding a way to create space and time on what you're doing and sharing that work with those that are in Sacramento or those that work with policymakers in Sacramento is really important. Last item that I'm going to share, and then I'm going to invite our panel up. Is anybody in this room familiar with Weaver's collaboration spectrum? Show of hands. Got a couple. So Weaver's proposed that basically there was a spectrum of the way that organizations and agencies interact with one another. And what she said was this spectrum started on the left-hand side with what she calls compete, right? So these are organizations that are literally competing for all kinds of things: attention, resources, people, on and on and on. It's the basic definition of turf wars, right? I want this, I'm gonna take it. And this continuum moves from left to right all the way until she gets to what she describes as the apex of this spectrum, which is called integrate. It conditions us to know that there's a great degree of trust. And what's even most fascinating about this, that there's such a tight relationship between organizations and agencies, you can't actually tell the difference between who is serving and doing what purpose, because in this case, the child or the youth or the client is at the center of that work. So we asked this question of all the interviewees. We said, when you think about the policymaking process in the state of California, where do you put that on this spectrum? And here's what we have so far. So I don't think this is necessarily a huge surprise, right? And the great news is there's a lot of room to grow, right? A lot of great room to grow. And what's even more interesting is when you cut this data by that definition of horizontal and vertical integration that I was talking about, we actually do better on the vertical integration results. That is, interviewees said that the system was better vertically integrated. We communicated what happened at the state level in policy. It moved to the county and regional level into local communities and neighborhoods. Okay, so that's what I got. Now we get to hear from our panelists. So I'm gonna invite Phebe, Myesha, and Lishaun to come up. And I'm gonna say a little bit about each of them as they walk up. So Phebe is the behavioral health director at Nevada County Mental Behavioral Health, doing it for quite some time and has quite a bit of experience working on state policy issues around behavioral health. Lishaun Francis is a senior director of behavioral health at Children Now, a firebrand in my opinion, which I love. And Myesha Jackson, who actually is not from the budget committee. She's policy staff in the speaker's office at the California State Assembly. She'll give her your official title, so that error is on my part. So let's get started.
Lishaun Francis. I got into this work because apparently I like to be emotionally tortured on a regular and consistent basis. I am optimistic to a fault. And so I think that we can make children's lives better and that we can do it in a way that is efficient and in a way that truly impacts the trajectory of their life as they move into adulthood. And everyone that I say this to in my family laughs and says, you should have just gone into finance.
Beautiful, thanks Lishaun. Myesha, you're up next.
Hi, Myesha Jackson. I'm the policy director for Assembly Speaker Robert Rivas in the Capitol. I got into this work on accident. I started at a nonprofit in San Francisco for long-term care advocacy, helping people and families dealing with the long-term care system. But then ended up moving to Sacramento and figured, well, I can't complain about things if I'm not working on fixing them. So that is why I work at the Capitol. I've been there almost 20 years now, just trying to slowly but surely help fix things where I can, and I'm really happy to be here.
Great, thanks Myesha. Phebe, you're last.
Hi, Phoebe Bell, Behavioral Health Director for Nevada County. After college, I kind of bounced around for a while, did all kinds of random work, and then discovered the field of social work and fell in love with the idea that there's a whole field dedicated to social justice, and went to graduate school and came out and worked in a bunch of settings, worked with people experiencing homelessness, worked in domestic violence agency, and after not very long, started to realize, like, this is super frustrating. Really crappy systems keep causing harm to people, and you can only go so long sort of picking up people at the end of that cycle, and quickly was like, I need to figure out ways to make the systems work better on behalf of people. And so moved into different nonprofits and eventually took on the biggest local system, the county government, and moved into this role a number of years ago now.
Great, thanks. So we're gonna break up the questions. We have two segments, a kind of so what and now what question. And for those out there too, if you've got any questions, we're gonna have just a few minutes at the end to maybe sneak in one or two. So if you've got a question or two, start thinking about it for the panel, and we'll try to sneak that in before the end, as long as Jasmine doesn't pull me off the stage. Okay, so the so what question. So you, just like everybody else here, got a chance to see some of these early findings. What do you make of them? Like, what are your impressions? Anything that surprised you? Anything you're like, well, duh, Jason, like, of course that's the case. But just would love to hear some of your initial impressions there. Maybe, Myesha, you want to start?
No, no, I will start. I had some well does for sure. I think part of the issue is that we cannot help but be siloed because, life is what happens while you're making plans, right? So all of us are kind of going to our daily jobs. We think, okay, I'm going to get this 20% or 30% or 40% of my day back so that I can focus on something innovative here. And right when you're in the middle of that, things come crashing down. You have to deal with the immediate thing in front of you. And then you end up getting off track and you think, okay, next week I'm going to focus on this thing. And that happens at your respective levels. It happens within the legislature. The members come in and they are excited. And there's a bunch of new ones, by the way, get to know them, fill them with all of this integration talk, please, so that they can be champions for these issues. But, they come in and they're like, okay, I have these long-term policy objectives. And then there's a fire, or there's something else that happens, or, the media latches onto something just wildly sensational that's not even worth focus. But they are responsible to their constituents, so they turn to focus on that thing so that they can address it for their constituents. And then, 4 months have passed, we're nearing the end of the legislative cycle, and they haven't been able to tackle the thing that they went there for. So it's really hard, and we need to keep having this conversation. And I think it's a matter of figuring out, okay, how do we force ourselves to put the work together, right? And what little things can we do to tinker around the edges, even if it's not the biggest innovation, of the year? What can we do to just make a connection to be able to better integrate policymaking?
Great. Thanks for getting us started, Myesha. Lishaun, Phebe, you guys want to jump in?
I think nothing was really surprising that you shared, but one of the things that I think we all do when we talk about integration is we center systems and not people. And I don't actually think integration is that complicated if we center people, because people live integrated lives. That's normal for most of us. We're not thinking, oh, today is my health day and tomorrow's my education day, and on Saturdays I do my banking. That's not quite how we all operate. So what ends up happening, I think, is an oversized influence of institutions that represent systems and not people in the legislature. And so what I mean by that is you might have, the hospital system might need something. That does not necessarily mean that what they need is also what consumers need, right? If the education system needs a thing, that doesn't always mean that that is exactly what students need. Sometimes they overlap, oftentimes they don't. But what you see happening is I do this myself as well, we all weave in these notions of policy that talk about what the education system needs with the presumption that that also means that is good for the student. And oftentimes that is just not how this works. So at Children Now, one thing we really try to do is center youth and families. We try to center children and families, because if we're centering them and what they need, integration actually becomes much more obvious. And I'll give an example. When CYBHI was announced, the state said, we're going to work on mental health and addiction, and we want to do some prevention work in the SUD space, likely at schools. And so we went to some of our youth partners and we said, hey, the state wants to do this thing. They want to really do some prevention work around substance use disorder. What do you guys think? And they said, oh, well, that's great, Ms. Francis, but if they come into our schools to do prevention and all the kids who would do drugs are suspended or expelled, what exactly is the point? The kids who are here aren't doing drugs. And I said, well, you guys are smart. You guys know a lot of things that I don't. And this is why we talk to you. But that is an integrated conversation, right? That is when health and education collide. So yes, you have some really smart, meaningful people who say, we're going to do this thing in schools around drugs. And the students are going, yeah, but anyone who uses drugs, they just aren't here. So you're preaching to the choir at this point. And so then your data says it's successful, right? I mean, so now you collected data and it's like, have you been vaping? Have you used drugs? And they're like, well, I was never going to do that anyway. This is not, right? So I think we have to be careful, but that is when we censor the system, right?
What do you got?
Well, kind of building on that same theme of the role of the system. And I will say, when I first came to county government after working in community nonprofits for a long time, I was, it's a little embarrassing to say, but kind of shocked by how many incredibly smart, incredibly dedicated, incredibly passionate people worked in county government. Because from the outside, it looked like a slow-moving bureaucracy that seemed change adverse and sort of like well-meaning policy adverse at some level. And so now that I've been in county government for a while and in the public behavioral health system, which is a big, large thing that's hard to move, I realize what happens between a great idea at a policy level and great people on the ground who want to do exactly what's intended with that policy. There's all these steps in between, and so much gets lost in translation. They are regulatory, missives that, tell you all the ways you're going to get in trouble if you don't do this thing in a certain way in a certain time. And so suddenly this like visionary idea gets broken down into regulatory steps that, an analyst looks at and reads and brings to a group of, managers who says, oh, we have to do this new thing. And you've suddenly lost all the energy of what was intended and hoped for. And so I'm not sure what the answer to that is, but somehow continuing to hold the vision at every level of the process so that the people on the ground, who very much, just as much as the policymakers, hold vision and energy and hope for the future too, get a chance to continue to ground their work in that, despite the sort of necessary regulatory ways that we're pushed down that path.
Yeah, I love this idea of lost in translation. And so just transitioning into this next question. So we talked a little bit about the so what. Thank you so much for your kind of initial thoughts and observations. Let's talk a little bit about the now what, right? So you've seen this data as well as anybody. We're trying to think about how do we advance better integration, and at a horizontal level, at a vertical level, this lost in translation issues coming up. Us, not really kind of listening intently to children and families as we're thinking about policy design. What do you say to California? What do we do next? How do we take a step, whether it's completely innovative and groundbreaking, or we continue to tinker because we think that that's the right path? What would you all put on the table? Who wants to start?
I'll start.
Great.
I think one thing we have to do is slow down a little bit. You were pointing out the volume of things happening at sort of the bill and policymakers level. I will say at the kind of community level, the volume of change initiatives hitting us right now is beyond the wildest imagination. It's just so really, truly insane to think that we can make this much change all at the same time and do it in any kind of meaningfully integrated way and have any sense of what worked or didn't work. And I think that's a key part of it. When you make 20 changes at the same time, how you pay people, how they do the work they do, where that work happens, et cetera, you lose the ability to understand what's effective. And so to really take some time to think about how all these pieces fit together also. We have, CalAIM was the biggest thing since sliced bread in behavioral health land until behavioral health transformation came along, and then, behavioral health connect, and then on and on and on. And so what is the landscape even? It's too hard to tell at the moment.
Yeah, Phoebe, one of the things I'm hearing there is that, there's a change that's initiated, say, under CalAIM, but then as you're just starting to even get acquainted with this giant reform, there's other waves that, continue to move. Yeah. Myesha, Lishaun, anything there or other things coming up for you?
Sure. One of the things that I wish we could all do is cross-train. And I know it's a dream that will never come to pass, but just, any of us who have been in a system versus in advocacy, a service provider, we can see different things, and we know, anybody who's worked at the county level or even at a departmental level who's come to work at the Capitol has a different lens and can say, well, here's how this won't work in terms of implementation, and here's what needs to change. And I think, my call to action for all of you is to get in early, have the conversations, legit talk about integration, and go talk to the folks that you wouldn't naturally talk to. Go talk to the other committees. talk to them about why caring about policy making for children and, you know, all the things we need to do to keep them safe and well and fed and healthy is applicable across the spectrum. There was something I got to do or kind of initiate with some folks from the Legislative Analyst's Office a couple of years ago. We were having a general conversation, and two of us were on, me and a person from the LAO, and I was like, yeah, we don't get to talk about certain policies across the board a lot. And the result of it was like, well, we have to talk about climate, which I know supersedes everything, and I'm not rolling my eyes at climate, super important, like we have to care about it. It matters to all of us. But we lose the conversation about, you know, people sometimes when we're talking about climate. But you know, we said, well, I said, can you guys do some reports on like how climate is impacting all of the things? So it was in education, it was in transportation, it was in health, it was in housing, and really focusing on like, okay, what are the impacts here that we're seeing that we don't, you know, get to have the conversation about when we're just focused on that particular committee and that particular bill that day. So if you go into transportation committee and you say, hey, look, this is why you need to think about kids in your policy making. Or you go into communications and conveyance where they deal with broadband. This is why you need to think about kids in your policy making. And of course, health, and of course, human services, right? And of course, education committee. But go to those committees that don't necessarily have the natural nexus, where it's very easy to be very siloed. It's very easy to kind of lose sight of the Venn diagram, and talk to them about why it's important for them to think, okay, through this lens of how is this going to impact children and families? And I think we'll see a change. We're also trying to inspire that with the members, right? So it's not one-sided. It's not just you all saying it. On the note of implementation, one of the things the speaker is very interested in doing in the coming year, and I saw a committee person here earlier, but I've already started talking to all of the chief consultants, and I'll be talking to the members about it in January, is he wants to do more oversight hearings on implementation of legislation, right? So like, what happened with those bills you passed 5 years ago? Where did they go? Are they serving the people you intended to serve? Are they doing it in the manner in which you intended? Are there gaps? Are there people we need to talk to get them better integrated at the local level or, you know, at the systems level to make this happen? So it is a focus we have in our office, fortunately. And so we're going to work on our side too. But in the meantime, like I mentioned, all of those members who are coming in and they are brand new and they're excited, they're still not jaded. So like get in early and talk to them and tell them, hey, in whatever you do, if you care about utilities, if you care about transportation, if you care about, you know, environmental quality, I want you to care about children and families. I want you to have this overlay of children and families when you think about these policies, because you have the lens already of trying to do no harm, but I need you to have this extra emphasis on how is this actually going to impact families, right? How is this going to impact communities? We have no money. We don't have, you know, we're not looking at what we were looking at a year ago, where we were able to kind of initiate new programs and, you know, boost programs. We are in the save, maintain, retain. And so it's really incumbent upon all of us to take a look at what we have in place, figure out whether it's working, figure out where the gaps are, what can we fix? We need to improve what's already there and, you know, slow down. And for better or for worse, we don't have the money to build on top of. So we need to slow down and really look at, okay, are we doing the best job we can for children in these spaces? Or do, you know, obviously we have work to do, but, you know, is there a way we can work better together? And that's the question we have to ask ourselves. Like, how can we work better together to improve these systems?
Great. Thanks, Myesha. All right, Lishaun, bring us home.
Yeah, I think the only thing that I didn't hear, but I'm going to piggyback off of Phebe and Myesha, is the role of intellectual humility in this work. And it's something I think about a lot because when I first started doing policy work, I had all the answers. Like, I knew how to solve for poverty. I knew how to solve our healthcare crisis. I knew how to make sure that we had quality education. I had all the answers. I was also in my 20s. So when you're in your 20s, you think you have all the answers. And that actually never goes away for some people. Right? That is what I've learned. Is that you have advocates, elected officials, a legislative staff, not Myesha, people in the administration who have all the answers. They know how to fix whatever ailment is in front of them, whatever social ill is in front of them, they have the answer for. And they're almost always wrong, right? Like, I tell the Department of Healthcare Services all the time, I've never met a family who said, you know what we need? We need this new CPT code. That'll fix it. The new CPT code is gonna get it done. It's never happened. Intellectual humility. I've had to learn that the hard way. Some people have never learned it, but that is what I wish for in this field, is more people who are willing to have conversations that maybe their great idea, one, isn't that great, or two, has been tried and failed for a reason. And that reason isn't because there are no other smart people in the room.